So today I'm going to be explaining step by step how to insert an NG tube into a patient. Unfortunately, I do not have a NG tube with me in order to physically demonstrate it on a stuffed animal or anything like that. So I'm just going to kind of give a step by step of how I would do it if I were to do it in a clinical setting. And the first thing, just like any other procedure that you'd really want to do, is identify the patient and the physician's orders, just to make sure everything matches before you would ever perform the procedure on the actual patient. And then you also want to kind of gather all the supplies that you're going to need for the procedure as well. So you're going to need an NG tube, obviously. And then you're also going to need some towels to kind of drape, or a chuck pad to drape on the patient, on their chest. You're also going to need an emesis basin and some ice chips, some water, just to have by the bedside, to kind of either aid in swallowing or just in case anything comes up or anything like that. So the next thing that you're going to do is, once you kind of have your materials to the side and you drape the patient with the either a towel or a chuck pad, you're going to actually place them in high Fowler's position first. You want to make sure that before you even insert the NG tube, measure anything, you want to make sure that they're sitting up at almost a 90-degree angle, so there isn't any kind of mistake that you might make whenever you're going to advance it. You want to make sure they're sitting straight up in high Fowler's position. And then when you measure it, you want to be sure you measure from the tip of the nose to the ear, the earlobe specifically, and then down to the xiphoid process. And once you figure out where that's at along the NG tube, you want to tape it, just to make sure whenever you are advancing it that you stop wherever that tape is. And so once you have the correct length of the NG tube, you want to make sure that you lubricate it with the tip of it with a water-soluble lubricant for about 3 to 4 inches of it. And then before you actually insert into the nair, you want to make sure that the patency of the nair is actually good also. You don't want one to be really clogged and then put it in the other and then not be able to breathe really well out the nair that the NG tube is not in. So you just want to make sure the patency is good before you actually insert it. Then once you go to insert it, you want to get the patient to do a chin to chest, position. And then when you go to advance it, you want to go backward and downward. And then if able to, you want the patient to be able to swallow, to kind of close over that trachea and really make sure that it goes down the right way. And once you advance all the way down to where the tape that you had put earlier is, you want to make sure you temporarily put it in place. So just make sure you put enough tape there to keep it still until you verify placement. And you can verify placement 2 different ways, but there's only one, golden standard that's accepted as, yes, this is in the right place, and that would be a chest x-ray. And if the a chest x-ray, and you could also do gastric residuals to make sure that it is actually in the stomach, and you would use pH strips to kind of verify that it is the correct pH of the stomach. And then once placement is done, you could either secure it with a specific NG tube. I can't really think of the word. The correct, it's like specific for NG tubes that'll keep it there, placeholder, I guess you could say, or you could just tape it. And then once you do that, you want to either clamp it off, or you could attach it to suction or feeding tube. And then once you're done and it's in place, it's good to go, verified placement, you can doff off your gloves that you had put on earlier after doing hand hygiene and prior to the procedure. And you can go document how the patient tolerated it, and any kind of gastric residuals, and what type and size of NG tube, as well as which nair you used, and yep, that's pretty much it.